welcome to Aging Matters, a program featuring interviews with individuals who talk about aging-related topics of interest to older adults and their families. I'm Cheryl Beversdorf, your host. Cardiopulmonary resuscitation, also known as CPR, is vital to saving the life of someone having a sudden cardiac arrest. Bystander-initiated CPR can double or triple the chances of survival from cardiac arrest. Today, we'll learn about a community CPR program called Hands2Hearts, a partnership between the Arlington County Fire Department and Virginia Hospital Center. The Hands2Hearts program teaches people how to recognize the cardiac arrest, request help, and initiate hands-only CPR. My guests are Stephanie Dubik, Patient Care Director at Virginia Hospital Center, and Rob Bowen, a Fire and Emergency Services Captain and Advanced Paramedic Officer with the Arlington County Fire Department. During our program, Stephanie and Rob will explain how to save the life of a person suffering from sudden cardiac arrest and also tell us about the Hands2Hearts program. They will also demonstrate how to perform CPR and use an automated external defibrillator, also known as an AED, until emergency assistance arrives. So welcome, Stephanie and Rob, and thank you for joining me today.
Thank you for having us.
So let's get started and learn a little bit more about cardiac arrest and the use of CPR. So let's start with you, Stephanie. Are older adults more vulnerable to accidents and injuries that may need immediate CPR?
They absolutely can be. A lot of times the older adult has more of what we call comorbidities. They have more existing medical conditions that can cause a cardiac arrest and for them to need CPR, specifically cardiovascular disease.
And explain for all of us, because sometimes I don't think people really understand, what is a cardiac arrest and how does that differ from a heart attack?
That's a great question. So a heart attack is actually where there is a blockage in a major artery, so your body's not getting blood and oxygen to all the areas that it needs, whereas a cardiac arrest is where the heart stops working completely.
Ah, okay.
Yes.
And and I just sort of wanted to insert here, does a cardiac arrest more likely need CPR rather than a heart attack?
Yes, so not all heart attacks actually need CPR. If you're having a heart attack and they're able to talk to you and tell you about the chest pain, then they don't need CPR. A heart attack can lead to cardiac arrests, but all cardiac arrests need CPR.
Because
the heart is not working at all.
The heart is not working,
yes.
And that's why you need it.
Exactly.
So I suspect this is true, but I just want to verify with you, how often does a cardiac arrest occur outside the hospital?
So outside the hospital, Arlington averages about 1 to 2 cardiac arrests per day. That the fire department responds to.
Wow.
Yeah, so it's enough that if enough people were aware of the cardiac arrest and started CPR, they could definitely save their life and before the fire department even arrives. So. And
the cardiac arrest, as we were discussing earlier, usually does occur more with older adults, or could it be middle-aged adults? What's your experience?
Well, cardiac arrests occur at all ages, and there's all kinds of reasons for a cardiac arrest. About 70%, 75% of the cardiac arrests occur outside of the hospital. I'm sorry, they occur at home. So
at home, okay.
At home. So it's why it's part for everybody to learn CPR. So if it's one of your family members that goes into a cardiac arrest, they can take action right away.
And from what I understand also, part of the reason you're doing this program is for bystanders. So it's not only just family members or caregivers, it's that bystander who might unwittingly witness a cardiac arrest that you want to train. Is that a part of it?
That's exactly the case. So if you're walking down the street and you go into cardiac arrest, you want somebody to help you. Hopefully somebody calls 911 and checks on you. But if you're in cardiac arrest, you need CPR immediately. So our goal is to teach everybody CPR so that if you are that unlucky person, that you get CPR right away in hopes that you'll survive and have no problems.
So Stephanie, since we are really focusing on older adults here, in your experience, can older adults perform CPR effectively?
Absolutely. I mean, realistically, anybody can perform CPR. Now, with the older adult, there might be some conditions that make it a little bit more difficult for them. For example, they've had a recent knee replacement or a recent hip replacement. It might be more difficult for them to get on the ground where the person who's laying needs CPR, but they absolutely can perform CPR. It might be a little bit more difficult for some people than others.
Well, I know we're going to be doing the demonstration later, but do they have the strength in their arms to do it? I mean, I'm just sort of thinking through
For most
what
people,
might
when
happen.
they need CPR, most of the time they're going to be on the ground. So when you're kneeling above them, you actually have your full body weight helping you do the compressions.
Okay.
So pretty much, yes, absolutely, older adults can definitely do CPR.
And what initial action steps would a trained individual take in emergency situations? So someone is having a cardiac arrest. What happens first?
First things first always is safety first. You want to make sure that it's safe for you to go and assist the person who's had the emergency, who needs CPR, whatever it might be. If it is safe for you to go enter the scene and help them, you want to check on the person. You want to call for help. That might mean you calling 911. That might mean asking another person who's with you to call 911. And then whatever, as you said, a trained person, whatever it is that you've been trained to do. So if you've gone through this program with us, you'd be trained to do CPR. You can provide whatever assistance you know how to do. And if you don't really know what to do, or sometimes people just forget, when you do call 911, the dispatchers are trained to kind of give you advice and walk you through exactly what to do in an emergency situation.
So, and that's also a good reason, hopefully, to have your smartphone with you, that you can turn it on and be doing CPR while
Yes.
you're talking to...
Have it on speaker and you can be providing CPR, absolutely.
Right. But, I'm hearing you say that it's really important to call that emergency,
Yes.
so that they'll be on their way while you're doing that. And I think the other thing that people are really interested in knowing is about, in the past it's been mouth-to-mouth resuscitation, and there was this concern about protecting themselves from illness or injury. Rob, can you talk a little bit more about that?
Sure. The CPR that we teach is hands-only CPR. People have been teaching hands-only CPR since about 2010, and a few years ago it really became even more popular because studies showed that if you encounter somebody in cardiac arrest and just do compressions, you're not even giving mouth-to-mouth ventilations, the chance of them surviving and having the CPR impact is the same as somebody giving ventilations with the compressions. So basically, for the first at least 4 to 8 minutes, ventilations aren't needed. So
all right.
for most cases of cardiac arrest in an adult or a teenager.
So tell me about the Hands2Hearts program. It's a community program. What are the features? What's the focus?
Okay. So our focus is trying to reach as many people in Arlington as possible so that we can educate as many on how to do hands-only CPR. We want them to understand how to recognize a cardiac arrest, and once they recognize the cardiac arrest, which can be kind of confusing, we'll talk about that later, but to call for help, which includes calling for an AED, calling 911, and then initiating hands-only CPR compressions. So that's really our focus, and it's very easy to teach. It's not hard to learn. So we have a great group that goes out to the community and provides us free training.
And you offer this in different places in the community? What are some of the places where you've offered the program?
Got it. So we go to festivals. So we like to go to a lot of health and wellness festivals. We'll set up a CPR training booth, and so when people come by, we'll do one-on-one or small group training with that person. It usually only takes 3 to 5 minutes. And then we also provide classes. So if you own a business or you're a member of a group or civic association, then we actually come out to your group and we teach the whole group CPR. And it only takes half an hour a lot of times. So it's good.
Well, let's take a look at that demonstration of the CPR, as well as the AED is another part we're going to be looking at. So, good.
So there's been a lot of changes to CPR over the last couple of years. So what we're teaching now is called the 3 C's. The first C is to actually check for responsiveness, to make sure they actually need CPR. Sometimes people just pass out and their heart's working fine and they don't actually need CPR. So that's the first C. And what we tell people to do is to take their knuckles, go right in the center of the chest. There's a long bone that runs down your chest called the sternum. And to push down very hard and to rub it back and forth and see if they respond. If they don't respond, that means it's a good indication that they really need CPR. Okay? So that's the first thing you're going to do is check to see if they're responsive. The second step, the second C, is to call for help. If you're by yourself, you can actually just take out your phone, put it on speaker, and call 911 so you have your hands free.
Okay.
If there's other people around you, you can ask somebody else to call 911. So that's the second step. You can also, if you're in a large area, especially a government building like a library or a school or even a mall, airport, you can ask somebody to get you the AED, which we're going to show you guys in just a little bit. The third C is to actually start the compressions. So I'm going to show you how to do that.
Okay.
So to do the compressions, you take the palm of your hand, go right in the center of the chest, directly between the nipple line. So that's perfect right there. Okay. Take your other hand and overlap it. Doesn't matter which hand goes first. Now the big thing is you want to keep your elbows straight and lean over the body so you have your full body weight. And you're going to push down about 2 inches. Go ahead. Push down really hard. Perfect. That's excellent. Now the next question that most people ask is, how often and how fast do I have to do this? Right? So do you know the song Staying Alive by the Bee Gees?
Yes, I do.
Okay, so if you sing that song either out loud or in your head, it helps you keep the right rhythm when you're doing the compression. So go ahead and try that with that song.
Do you want to sing it for me?
Sure, I'll sing it for you. Go ahead.
All right.
Go, staying alive, staying alive. Great. Now, the big change to CPR now is that you don't have to give breaths anymore. So you don't have to count the number of compressions you're doing to stop to give the breaths. You really just need to make sure you're keeping that right rhythm. So you're doing it, that song helps you do it about 120 times a minute. So go ahead and do it again, kind of put it all together.
Could I ask one question too?
Absolutely.
One of the things when you said about response, and you said obviously pushing on the sternum, is taking a pulse or anything, will that help at all or not? Like
so they used to teach that a lot, but the reality is that it can be very difficult to find it.
Oh, okay.
And you have a lot of adrenaline hardening. It can be kind of hard to tell if you feel it. And there's also been times where you can actually, there is a faint pulse, but their heart is slowly stopping to work. Okay. And they're going to need CPR. Same thing with the breaths. It can be very hard to tell if they're breathing. Mm-hmm. You look right now, I'm breathing, but you can't really see that I'm breathing. So you can check those things, but we're really getting more towards doing that hard sternal rub.
They're either going to react or not.
Exactly. And it's very painful if you're pushing hard to do that.
Okay.
In real life, it's going to be a little bit easier because they'll be on the ground and you'll kind of be kneeling next to them. But what we strongly encourage you to do is to ask for help. Ask the people around you, does anybody else know CPR? Can someone step in and help me? Because it can be a little bit tiring doing that.
Would I hurt the person? I mean, I'm thinking if it was an older adult, they might be quite fragile, and that, is there any chance that I could hurt the patient?
There's always a chance that you could break a bone, break some of those ribs, and that's okay. Actually, the ribs breaking actually allow more pressure to go on the heart when you're doing the compressions. And again, I always tell people, I would rather be alive with a broken bone than be dead. So you shouldn't worry about injuring them and breaking bones. It might happen, but that's totally okay.
Okay, and what I'm hearing you say is that I have to just continue until we get some professional help.
Exactly, yes.
Okay.
The other time that you might stop is when somebody arrives with an AED. So if we were in a scenario, let's say at the airport, and you ask somebody to go get the AED, and they come along, when the AED arrives, it will tell you to stop doing CPR momentarily so the AED can do its job. So I'll let Rob talk about that.
All right, so the AED is, you mentioned it earlier, but automated external defibrillator. Mm-hmm. They don't all come in a blue bag. Most of them are in a red.
Oftentimes in a glass encased in some kind of, like airports or whatever. Is that
exactly?
correct?
So in a square white box, similar to a fire extinguisher, just that type of box or different shape, and it'll oftentimes say AED above it on a sign, or have a little lightning bolt sign on it. But either way, it'll be labeled as an AED. So go to that box and open it up. It might say that the box is alarmed. It's okay. Open it up. If it's at the airport, actually when you open that box, it will alert the dispatcher that there's a cardiac arrest nearby, and it will send the police and the paramedics
Oh, that's all
right to your
connected.
location if nobody has already called 911.
Wow, okay.
But not every place is like that. So you should still call 911
Yes, just to be sure.
and get help on the way while you're doing that.
Okay.
So, all right, for the AED, these are made to be super simple, self-explanatory. You don't have to be a medical professional for this. So you just, if the person, when you're going to use this, the person has to be in cardiac arrest. So somebody that, we're talking about a heart attack earlier, somebody having chest pains, my chest hurts, I can't breathe, you're worried about a heart attack? They're alive. Don't use this.
Right, okay.
This is only for somebody who's not breathing or just gasping for air. So a lot of times cardiac arrest patients, usually they're either not breathing or they're not breathing normally. So she was talking about breathing earlier. So if you notice they're breathing normally, we don't need to do CPR. But people who often go into cardiac arrest from some kind of heart issue, they still have oxygen in their system, and then their brain's telling their lungs to breathe, so they have these gasping breaths. So
Is their skin color also like blue or?
not initially. It will turn that color
Okay.
once the oxygen starts to deplete, but initially no. It might turn pale and then blue. So we want to get to them
We want
before
it
that
to pink,
happens.
right?
Absolutely.
Okay.
So recognize that unresponsive and they're not breathing normally or not breathing at all. We're starting CPR, and when you send this person, I'll be the person grabbing the AED. I'll go grab it from the wall, and then I'm going to turn it on. They're all labeled steps 1 through 2 or 1 through 3.
All right.
So we'll just turn it on, step 1, and it walks you through exactly what to do. So,
Apply pads to patient's bare chest.
all right, so they all have pads in them.
Plug in pads connector next to flashing light.
So we open it up. We want to do this a little bit expediently. These pads are labeled. So they have a label and it says exactly where it goes.
Apply pads.
Thanks.
Plug in connector.
So if I'm going to put these on and you're the one doing compressions, your goal is to continue compressions.
All right.
So my job is going to be the AED, and then your job is going to be the compressor. So we'll just have you put your hands on the chest to simulate compressions are being done.
Connector.
Okay, so
So
keep doing.
yeah, so you can just hold it right there. You don't have to do compressions.
Oh, good.
I know it's
Okay.
tough on this table.
Okay.
But I'm going to place the pads around you, and you're going to be continuing CPR,
Okay.
Yeah.
and then
Apply pads. Insert connector
So-
firmly.
there we go. These go into patient's bare skin, so clothes are cut off.
Analyzing heart rhythm. Do not touch the patient.
All right, so when it
There you
says
go.
that,
You would stop right there.
yeah, so back up. You're going to stop doing the compressions, and this
Shock
is,
advised.
there you go.
Charging.
So I want to make sure,
Clear of patient.
I want to make sure nobody's touching the person, because I don't want to shock
Deliver
them.
shock now.
The
Press
the orange button
now.
flashes, so I shock them,
delivered.
and then you're always going to go back into
Pause.
CPR. It'll tell you.
Does it actually?
It does provide an electrical
Jump.
shock, and you will see them flinch a little bit. It's
Okay.
usually not quite as dramatic as you may have seen in
Right.
some of the movies, but yes, they will
Television,
shock.
yes.
Yes.
Okay.
I'm going to turn this off just so we can talk without the machine talking over
Okay.
us. But just to clarify, after we shock, we're going right back into compressions.
Yeah.
And you're going to be tired. So it's tough work. You've already figured that out.
Right.
So hopefully there's somebody else, whether it's me or Stephanie, to take over and do compressions. So those are some things here with placing these pads. You have to have, it has to go on bare skin. So a lot of times these things will come with a little first aid pouch, and they'll have scissors. So if you can't pull the shirt up or pull the bra up if it's a woman, then you can, they have the scissors, the trauma shears, you can cut the clothes off, expose the chest, pull the bra up or ideally cut it, and then you have access to the bare chest, so you can place the pads, and electricity can go through and shock the heart if it's indicated. Now this said to shock the heart. It doesn't always happen like that. It only shocks 2 rhythms, but there's all kinds of different rhythms. So if it's in one of these 2 rhythms, it'll shock it, but otherwise it may say no shock advised, which is okay. We just need to go back and do CPR if they're not responding and they're not breathing or not breathing normally.
Is it possible that perhaps somebody has a pacemaker? Would that interrupt or
Yes.
interfere with
So
the AED or the
defibrillations.
CPR? Yeah.
Sure. So the pacemaker or an implanted defibrillator is more commonly placed up on the left side of the chest, left upper chest, and you'll see a raised underneath the skin, be like a little box or circle that's raised up.
Okay.
So it'll be very clear that something's there, whether it's a medication port or the defibrillator or pacemaker.
Okay.
on occasion, it's over here on this side of the chest. If that's the case, then we're just going to position the pads maybe off a little bit to the side. We just want electricity to travel between these and go through the heart right here in the middle. So we're just not going to put it right over top of that pacemaker.
Okay.
The other thing we encounter sometimes are men with the burly, hairy chest. And we don't want to, these can't be floating on a hairy chest. These have to be on the
Right,
skin.
they have to be on the skin.
So there's a couple options. Press it firmly, hopefully it'll stick. If it's not sticking, these usually come with a backup set of pads. You can take these and do a quick waxing on your male friend there.
Wow.
Get the other pads out and put them on the newly waxed area, and you're good to go.
Do I need to be afraid? I mean, we always hear about the Good Samaritan law, and should I be afraid that you mentioned before about hurting, breaking ribs or whatever.
Right.
Would I be exempt if I actually did that?
No, so the Good Samaritan law protects you as long as you truly believe that this person needs help.
Okay.
And you're doing what you know how to do, and you know how to do CPR. And even if you weren't 100% sure, remember we talked before about the dispatcher being on the phone. They'll actually walk you through step by step of how to do CPR, of how to apply an AED, and you're completely protected through the Good Samaritan law.
And what happens if the person is still not responding after you've done AED and...
Continue to do CPR. The paramedics, and especially in Arlington, the paramedics arrive usually within 4 to 5 minutes.
All right.
So we have a really pretty good response time. We'll be there to take over CPR. We'll take over with our own monitor for defibrillations if necessary. And so we'll get there quick. So just bear with us, work with the dispatcher, use your friends around you to help support the cardiac arrest management, the CPR, and we'll be there soon.
And as long as I can do it, I should continue, even if I'm not seeing any response from the patient.
Absolutely.
Right.
Okay. And would I check any other kind of, I guess my nursing background, you think about vital signs like pulse or respirations or whatever.
So there are a couple of things. When you use the AED, there's usually there's a 2-minute pause. So after 2 minutes of CPR, it will reassess the person to see if they're alive, or to see if there's a shockable rhythm. So the person's still in cardiac arrest. In 2 minutes, it will say, stand clear, analyzing heart rhythm. So people were like, oh, is this broken? Do I need to turn it off, turn it back on? No, just let it run through its process, and it'll tell you exactly what to do. Once the person, you get them back and they start moving, then we'll stop CPR. So you notice they're breathing normally or they're moving. You've done a great job. You saved their life. We can stop CPR. And if you're worried about vomiting, we can turn them on their side.
Oh, yes, because I was thinking about the airway. So anything else that we need to know?
I would say
this has been great.
the biggest thing to kind of take away from all of this is to not be afraid to jump in and help out. As we talked about before, that bystander CPR and somebody jumping in, even if you don't do it perfectly, even if your compressions aren't as good as maybe the EMS and the fire departments might be, doing something is better than doing nothing. And it doubles or triples the chances of their survival. So we want to encourage people to not be afraid to jump in and try the best that they can. That's what we really want everyone to take away from this.
Yeah.
Any final comments, Rob?
I think that's truly why this program is so important to the fire department and to the hospital, is that we know that if you, as a bystander to a cardiac arrest, so you witness this cardiac arrest, if you take the appropriate actions, you are going to be the ones that save their life. It's not going to be the paramedics or the nurses or doctors at the hospital. So it's going to be you, the bystander. So this is why this is so important to us. If you do CPR, if you have an AED, that's great, use that. You'll be the one saving a life. We'll be there to support you and give you a pat on the back, but that's why this is so important.
And I suspect that when you're doing this, you're really happy when the emergency personnel shows up.
There's a little bit of a sense of a relief, I think, for most people.
Yes. So, well, thank you both so much. This was fabulous, and I hope a lot of people enroll or sign up for the Hands2Hearts program.
Yes.
Thank you.
Well, thank you so much for that wonderful demonstration. I must admit I was a little nervous waiting to be shown how to do it, but I appreciate you experts showing.
You did great.
Showing me how to do it. So I have a few more questions just to kind of close out this. How many people have actually been trained in the Hands2Hearts program since it started?
So far this year, we have about 3,200 people. Our goal for the year is to reach 4,000, and we are very close. We think we'll probably reach it within the next month or so.
Wow.
Yeah.
That's and so explain, how can older adults and their caregivers and their families learn more about how to save lives in emergency situations? Do you have we have a wonderful sign back here, but do you have a website, or how can people find out and sign up?
Yes, so we do have a website and we have an email address. Actually, the website is mostly through the Arlington County's website. It has all the information about this class. In addition to this class, there are lots of other ways for the older adult in our community to learn things. Specifically, there's the Arlington CERT program. There's a lot of information on the Arlington website. The Virginia Hospital Center has a lot of classes that we can teach, a lot of just life-saving first aid stuff. Lots of different information is available.
And they have a lot of information for older adults as well,
absolutely.
Just in general. So Rob, and how can people learn more about the Hands2Hearts program? How can they schedule it? What do you suggest that they do?
I think the easiest way is if you go to the fire department's website, the Arlington County Fire Department, and search CPR, or you can Google Arlington.
And what's that website address?
So
the fire department?
arlingtonva.us/fire.
Okay.
So, or you can just Google Arlington Fire CPR, and it'll come up. It'll be the first thing there. So it's super easy to find us. Once you get on that web page, there's a whole explanation about our program. There's a form that you can fill out, and you just fill in your information about how many people you want to have trained, where you want the training to be, when you want to have it. We both get an email, and we schedule the training. It's super easy. We also post when we have upcoming public events. So if there's a fair festival coming up where we're going to be attending and having a CPR booth, we'll put that up on our website as well. So there's plenty of ways to find out how to reach us, and there's also an email address that can get to us as well. So if they have more questions that aren't answered in the website, they can go there. So that's how to reach us.
And is it it's a one-time only session, isn't it? I mean, it's all in one period.
We do it all in one day, one period. And it usually takes, like I said earlier, like about a half an hour, but sometimes 45 minutes, depending on if you want to learn about the AED or choking. We'll talk about that as well. So, and that usually takes about 45 minutes. And additionally, we only focus on those three things, really: CPR, AED, and then we also cover choking sometimes. If you want to learn more about infant or child CPR, then you can go on the the American Heart Association website or the American Red Cross website, and you can find a link to classes being held nearby that will provide CPR and first aid training more comprehensively than our shorter program. And they also provide certifications. And that's linked on our webpage as well.
Well, I want to thank you, Stephanie Dubik with the Virginia Hospital Center and Rob Bowen with the Arlington Fire Department. This program is broadcast Sundays at 5:30 p.m. and Wednesdays at 6 p.m. on Comcast Channel 69 or Verizon Channel 38 in Arlington, Virginia, or streaming live at those times on www.arlingtonmedia.org. Aging Matters is also on the radio, Tuesdays at 2 p.m. and Fridays at 6 a.m. on WERA-LP Arlington 96.7 FM. And you can listen to all those radio programs by visiting www.mixcloud.com/Aging Matters. And finally, all Aging Matters, television and radio, can be heard by looking at the Aging Matters Facebook page, which is www.facebook.com/Aging Matters WERA. So, until the next time, remember, age is just a number, not a label. I hope you will join me on the next Aging Matters program.